I'm Doc Villerreal, also known as Doc V. I'm practicing allopathic family physician, but also integrative. So I have a clinic up in northern Stafford called Embracing Health, and I'm recognizing a lot of wonderful customers who've tried us out, and thanks, appreciate it. Now I feel like I'm talking to family here. So if you want to learn more about it, I do have some cards over next to Wild Tree over there. I have been given the assignment, first of all, to speak to you after lunch, so hopefully you'll stay awake. And also about tools, some of the tools we use to identify the toxic issues. Now, most of these tools I use in the allopathic world. And what is allopathic, if some of you aren't familiar with that term? It is your mainstream, notice I didn't say traditional, mainstream medicine, white coat, stethoscope, pill for an ill, do as I say or you will die kind of medicine, right? But the integrative is much more taking the blinders off of our kind of tunnel vision. And we are finally living in a time where you're seeing a huge change in America. So I am certainly just one of many who've come before me, and I'm still learning so much. And I learn from my networking, Dr. Jackson and Donna, and I mean just everybody, and Keely. And I am very happy to refer to my integrative group as easily as I would refer to my allopathic group. So I would easily give a referral to a GI consult, but also to my nutritionist and to my chiropractor, Dr. Thompson, everybody. And we are appreciating that there are so many ways to heal, and that's an ongoing theme. So diagnostic tools that aid in detoxification. I've got a little dump truck there. It's basically identifying common barriers to the body's waste collection and removal. So what we will be covering, I'm hoping to summarize, of basically looking and identifying barriers. And it can be done in some simple ways, like structural barriers. Is there something there that shouldn't be there, keeping good stuff from coming in? Or are there bad things coming in because we don't have a good barrier, such as leaky gut or hyperpermeability, intestinal status. Deficiency barriers, of course, that plays a part. The body needs a lot of tools to make things happen, and if you don't have it, that's one tool that it's just not going to do the job as well. Thank goodness we have redundancy and the body can shift, but still it's not going to be working as great as it could. Genetic barriers. I am going to briefly talk about the MTHFR, but there are so many genetic barriers we're finding today. And now that we've decoded the human genome, it's a big player on some of our future therapies and ways of recovering, getting around these issues. Infectious barriers, probably the most common we find, and the one we often blame. Oh, here's one that's always blamed. A spider bit me. How many times do we say a spider? Those poor spiders, they're getting a bad rap, okay? They don't bite half as much as people think. Many times it's a simple bacteria of a Staph aureus that we created with our weird probiotics, not probiotics, our antibiotics. So it's an interesting kind of effect. Emotional and energy barriers, they did talk about that a little earlier, and a very big player on healing. So before it ends, I also hope to just give you a little bit of an idea how to create your team. Remember, primary care now is the best, self-care is the best primary care. If you are head of your own health, things can go a heck of a lot smoother. And it's also an issue for a lot of us to approach our allopathic doctors, should we have one, to be open to and listen to other types of healing techniques. So I was going to hopefully talk about that in a brief slide or two. So how does the body detox? I don't have to go too far into this, but I created this because when I was in med school, we always tried to figure out ways to remember things. And I noticed that a lot of ways we detox, I can put a letter S, you know, like a S word. So for instance, we will perspire, we'll sweat, right? Or we'll urinate, shishi. Now that I got from Hawaii, because that shishi is what's used in the Philippines a lot. Give me a little shishi and they know what I'm talking about. So shishi for urinating. I think you got the defecate one there. Spits, expectorates. We shed, we exfoliate. Okay, and sleeping, slumber. I mean, we really do a lot of detoxing in that stage, and many of us weren't aware of that. But just recently, they found a whole new lymphatic system that they never saw there in the brain. So it's changing our whole paradigm. It's making us realize that there is a lot of whole body connection to the brain and the effects of what the body's going through, what the brain's going to be doing. Spews, and of course there's metabolism and methylation and meditation, all these ways to detox, but the basic, I think it's falling, the basic message is what's moving out, okay? All right. So let's start with something like the gut. I'm not going to go into too much detail, but this is an amazing, amazing system. And I like to look at things simply because I come from an artsy-fartsy background and then got caught up in medicine. I don't know how that happened, but it's a fun adventure. Anyway, I like to see the human body as a tube going through the environment. And we will take things in our mouth and chew it up and throw in some our own spices, our enzymes, start bringing things to a smaller molecular structure. By the time it hits the stomach, we have some great acid there to kill some other bacteria, so there's a defense mechanism going on. And it goes further into the intestine, and there's certain areas in the intestine that says, here's my vitamin C, here's my vitamin B12. And then we pack it up, take out the water, make some nice poop to the next ecosystem. So this is really a fabulous system. The skin, I mean, how many people really realize how amazing the skin is? I mean, I know our anestheticians do, but this is doing so many things at the same time. It's sloughing and sweating, and it's also, as she was pointing out, our acidic pH balance for a protection against bacteria and invaders. We have a muscle system right behind the hairs so that you can shiver when you're cold and create more heat. And you think hormones only stay in your body. No, you sweat out pheromones. And so that's another reason why a lot of us women can cycle together. We're affecting each other. Here is interesting, this is a twin A and twin B. And you can see they went through a whole different life type of toxic and stress effects. So you can see a lot just on that skin. Lymph, you've heard a lot about it, so I can go quickly through it. It's one of our it's an amazing system, an immune system. And I like to look at it simply as almost our sewage system, but it does even more than that. So it can take a lot of excess fluids and transport it back to the thoracic duct, keep us flowing that way, but it also will transport proteins and other nutrients, and hormones do a lot of traveling through the lymph system, because your ovaries, or in the case of men, testes, when they secrete, they're actually going in through the lymph system. This is one of my, doctor pictures. If it's too squeamish for you, I'm sorry for those who are squeamish. But the lady on the, I guess that would be your right, she has one leg that has a lymph system that's been damaged, and it could have been from surgery, as Dr. Thompson once mentioned. It could be from so many other things. The typical one on the left is elephantitis folaris, and that is a parasite that loves to live all over the body, but it does seem to make a lot of damage in the lymphatic system. So when you have some scarring, you'll have some very gross features with time. Anatomy of an animal cell. I love this. Colorful, beautiful, but what I really wanted to impress upon you is that they act like a teeny little human themselves. They'll bring in nutrients. They'll fight and eat toxins. They poop out oxidative stresses and radicals that are made. They have the mitochondria acts like a pulmonary system, and that's where we also get a lot of our energy. What's really neat about the animal cell is they do think at one time they were two different cells that lived together nicely over the millennium. And we help the mitochondria, and the mitochondria helps the big cell. And of course, many of you know that the mitochondria, the DNA for the mitochondria is passed by moms. Okay, so that's the true lineage that we could probably make our way back to Eve if we so wish to look at it. What kind of toxins am I talking about? Well, we've already talked about them, so I'm just going to briefly say the ones I tend to look for are things like chemicals, man-made or even found naturally in the environment. Food, medicines. People forget that the prosthetics, you have a hip replacement, the metal there too can also be a bit of an issue, and I think it was a case for one of my patients. They had to change out and given an updated hip. Other life forms, parasites, bacteria, viruses, fungus, And I did throw in cancers there. Cancers are a very unique thing. They're being blamed as almost like if they're coming from the outside in. Cancers are from the inside. We make them. They're our Frankensteins, okay? So they're natural human cells, and then something goes wrong. Usually it's a perfect storm, and one turns crazy and forgets its boundaries and wants more food. So many times that will pull a lot of issues and can be a barrier, not just from what they're pulling from the body, but their mass effect. So I did put that briefly up there to think about. Yes, that's usually on everybody's mind, but we forget the perspective. So what are the tools? That's really what I'm supposed to talk about, are tools. Okay? I always start with the basics, and all of us use these all the time. We look at a person, just like we saw that twin A and twin B, you can see if somebody's toxic, if they're just not looking well. The next picture, we listen. We're supposed to. I think that's me and my colleagues. We say, whoa, too much information, I can't process. But basically, we can hear what their history was. I know Donna does a lot of this. She'll spend an hour just looking at where they were born, where did they work, what things were they exposed to, a farm next door or a cattle ranch or a glue factory, whatever. So these things will definitely have an effect on us. The nose, of course, you can even smell certain things. They are, oh, am I having feedback? Probably. Certain bacteria have very specific smells. I think Dr. Jackson knows that. Some will smell like almost a dirty tennis shoe. Those are, I think, the Pseudomonas types. And taste, well, that's a very old tool. We don't taste anymore. But back in the Middle Ages, they did. They'd actually put a little bit of shishi right on the tip of their tongue. And they could usually tell if somebody's diabetic or not. You could taste the sweetness in the urine. So we do use the olfactory with the tongue issue, of course. This is what I tend to use the most of, which is blood work and urine and many times stool, but that's usually not my first go-to because people don't like to handle stool that much less collect it and give it to somebody. You know. So, but we can learn a lot on what's just in the basic blood work. Now, the thing I wanted to point out here, and sort of what we do in our clinic, is there is normal and then there's optimal. And normal and optimal will have a huge effect on how you treat somebody and what other things you look for, okay? So normal would be somebody who's feeling fantastic and somebody who feels like crap but not in the hospital, okay? And I like to push them more towards the optimal. And even still, there's different levels for everybody. There will be, sometimes I'll look at a number and I'll say, oh my gosh, aren't you feeling this, 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 and this? And they'll go, no, I feel great. Treat the patient. I know myself and a lot of colleagues have been blamed for treating numbers. We find comfort in numbers, but it's not always correlating. So, what barriers are we going to look for to detoxify? I chose this because I used to be a flight surgeon. That's how I got my medical school paid for. And we had to pass a obstacle course. And so all of us flight surgeons would run to this wall and bang into it, just bang into it and go back, and we couldn't get over this wall. We had bruises all over. Well, one nice Marine who was going through the same training with a different class told me this technique. You basically, especially for us women who don't have a lot of upper body strength, you got to push yourself up and hook that heel over, and then you can use your strong legs to push you over, and you'll get through. And I only had one chance at that, so he gave me that technique. Later I married him, but he was, it was a good technique. So how do we go above a wall, around a wall, or whatever? Heavy metals. You guys heard about heavy metals. Yes, we need metals, as everyone was saying. There's some trace elements that we need that are very important in making enzymes to create the whole metabolic system, but too much of a good thing is not a good thing. So we usually will use blood, urine, and yes, you can look at hair. Hair is an amazing area to look for because it's going to have a time machine right here. You basically are pulling out what you were exposed to years ago. These little creatures, I think it's not so much even what they are, but what they leave behind. So your top pictures there, those are the wonderful ticks that we are having plenty of this season. Whenever it's moist, they come out in groves. And the deer tick is famous for giving Lyme disease. We have a good collection of Lyme disease out here in Virginia, West Virginia. And also the Lone Star. I know Keely wanted me to talk about the Lone Star because that's a very common tick out here. It's the one with the little dot on it. And it's notorious for also passing Lyme, but Rocky Mountain spotted fever, Ehrlichiosis, tularemia. I think that's how you say it. So again, it's not so much them, but what they left behind that we're dealing with. Now Lyme, pretty newly found, I mean, it's in the 20th century that we discovered this issue. It's a spirochete, a nice little corkscrew type of bacteria, and it has a lot of similarities to syphilis. And it's turning out that it's almost acting like syphilis. So when it comes to tools and discovering if you have that infection, I think most of my colleagues would agree that if you have a positive test, blood test, then we can pretty much say you have the infection. What my colleagues and I cannot all agree on is if it's a negative test, does that still mean you don't have the infection? Because this Lyme disease is very notorious for hiding in tissues, and now we realize it can actually affect the brain, just like syphilis can affect the brain. The mosquito, probably the most famous vector of disease in the world. Malaria, believe it, even though not here, is still one of the #1 killers. And out here, it's notorious for West Nile virus and other types of virus. Funny enough, with West Nile virus, that is actually a lifespan that goes in birds. And sometimes the mosquito will then bite at either human or a horse, and then they can get that West Nile virus. And if you got 5 people bit by this mosquito and got the West Nile virus, 1 out of 5 tends to actually have symptoms. So it's kind of interesting because it's like, why? Why that one? And it comes right back to what's your health? How's your immune system? The bottom one, I guess I'm keeping this slide out too much, is the one that everybody gets grossed out at. And again, it's not so much the worm, but what the worm is stealing from our body and basically taking our nutrients, like the tapeworm. That used to be a weight loss pill, I think, back in the 20s, tapeworm. And the mass effect when they grow and this take over in the body. Candidiasis. But actually, this is part of our normal flora. It's just that we don't want it king of the hill, okay? Especially certain candidiasis like Candida albicans, which is a very common one. But there's many species. And in this case, it's actually showing on the skin. And by the time it shows on the skin, you know it's overgrowing in your gut. That's kind of the rule of thumb. So it loves moist places, and ways to not help it grow is don't feed it. And it loves to eat on sugars, high fructose corn syrup, breads, pasta, simple carbs. Oh, and it loves antibiotics because it can't kill it. So you get rid of its other bacteria that keeps it controlled, which then leads a little bit into SIBO. I was discussing with another colleague just a minute ago that SIBO stands for small intestinal bacterial overgrowth. And that too, if you have too much of a good thing and getting out of balance, can truly affect your absorption ability and the ability to use tools effectively in healing. Genetic testing, that's a biggie now because we finally have shown what the human genome looks like. And of course, everybody knows Angela Jolie and her BRCA testing and making decisions based on that. So it's a very real decision protocol for many people who are at high risk. But one that's getting a lot of data now, you're going to hear more and more, is the MTHFR gene mutation. And my nurse affectionately calls it mother-father gene. Somebody else I know was using a different word. But this baby is really quite powerful. And to briefly tell you, it stands for methylene tetrahydrofolate reductase. I said it. And what does that do? Well, when that is out of whack, which works on other amino acids using a vitamin B9, also known as folate, then it's going to make homocysteine into methionine, and then methionine is then supposed to make some other, it's like, oh my God, so let me just show you what it does. That's what it does. Actually, it's only a small little area in the methylation form and in the B12 area, but so dang important. So as I was pointing out, we had this conversation at lunch, all my ladies over there. If you take that beautiful picture of the domino effect, where you just hit one domino, and it then hits more dominoes, and you can make incredible patterns. That's sort of what this gene mutation does. It has a huge effect on the body and your ability to absorb nutrients well. So in a nutshell, what happens if mommy or daddy or both give you a defective allele that will have a problem making this reductase? You are at higher risk for blood clots, cancers, leaky gut, infertility issues or lost pregnancies, bipolar, depression, anxiety. I mean, the list is incredible, and it's what's been blamed for all kinds of other things, and then sometimes if we just see this one little issue, we have ways to get around that wall. So, package deals. Hey, with the internet now, you really don't need me. You can get did I say that? I didn't. You can actually buy a lot of these packages directly from the companies. And I've listed a few companies in bold. Genova Diagnostics, now married up with Metametrics, so these are two very fabulous lab companies that test things like Nutri-Eval that I had written there, GI comprehensive effects, IgG food antibodies, many, many ways of looking at life in yet a different way, and what you can do about it. But again, these are numbers, and I have come across individuals who've probably bought every lab they can and tried every vitamin they can, and they are still dealing with obesity, high blood pressure, incredible fatigue, but now they're broke. So, you know, something to think about. You might want to get a team together on how to use these numbers to your advantage. So that's another thing. Don't forget one of the major things on health, and that was touched upon, and I want to reiterate energy. It's a very powerful effect on what will have one person who has the same disease recover and another person not, or how a child will die without love and touch, and another one will meet all odds and make it through because they have that surrounding incredible energy. So look at your colleagues and look at your other healers in the community, like I am very happy to network with, and that makes a big difference in recovery. Okay, so other testing that I just wanted to say is I was just mostly talking about allopathic type tests, but Ayurvedic, Chinese medicine, shamanism, they all have their own types of tests and ways to determine what would be a barrier from your detoxifying efforts. So how do you approach this to your allopathic doctor without getting the rolling eyes or, yeah, okay. I have a lot of individuals who said, me putting the integrative word in my title really opened up the doors for them just to talk to me about this, so that I would not look at them like they're crazy. Things are changing. With the internet and everything, we doctors are going back to school, and we have to realize that, yes, there is a lot out there. Thank goodness they're even teaching acupuncture to MDs over in Harvard and out in California. We're finally marrying those two philosophies and appreciating that we were speaking the same language, just using different words. And just understanding that is just broadening out all your abilities to identify and help treat toxic issues. So, know what you want. Know that you are going to be the captain of your ship, and find a team who will respect that. So if you have someone who doesn't really want to communicate with other healers, go ahead, look for another one. Things are changing. You'll find them out there. I'm out there. And I'll talk to anybody you want to put on the team, because I don't want to play your mother. You had your mother. You have a mother, okay? You are an individual who knows what's important to you in this life journey. So I'm going to respect that. That allows me to sleep better, because when I was first coming out of med school, I was very frustrated. First of all, very insecure. So when you're insecure, all of us suffer from this, we become defensive. And when we become defensive, it's like, oh, we're poo-pooing things and not keeping our options open. And then we're just sort of shooting ourselves in the foot and not letting ourselves progress. In that same vein, maybe even if the other person doesn't understand what you're talking about, you can use them for their expertise and use that information to make your own decision. One of the hardest things I ever come across is when somebody says, "Doctor, just fix me." Life is way too complicated. I don't have the magic wand or the magic pill that they expect. But we can be on a journey. Just like if somebody's walking a tightrope, you're always going to have to adjust. Got to prepare for those gusts of winds before you're toppled off. But it can be an incredible journey and a wonderful way to get to the other end. So Don't forget, you do have the healing energy. It was talked about. It's true. There are photographs that you can actually see the energy power coming out of you, out of vegetables. When the vegetables are cooked, it looks like a little less energy, canned, dead, you know. There's a lot of that wonderful power out there. And once you start a journey, like we've been able to see in a few of our related customers, they become healers themselves, and then they pass it on. So don't forget, you have that power too. Yes?
What one test would you recommend? If you go to one of those labs, which is the one test everyone should have?
Should have. Well, I'm sorry, but there isn't one that everyone should have. Now, a baseline. Oh, the question was, what one test should everybody have? And it really depends on the person. Because if I'm just wanting to make sure that person that doesn't need to go to the ER, I'm going to get my baseline CBC and my Chem panel to see if everything's stable and they're not going to go into a cardiac arrest or I have to call some emergency. Okay, so that's that particular population. If somebody's walking in saying I have extreme fatigue, I still start with the basic CBC, CMPs, and urine. I mean, you can really learn a lot, and then that gives you a segue to other places. But some of the unique tests that I really am having a great time with is the Nutri-Eval, because that gets you even more detailed on certain nutrients that might be missing from your diet. Plus, it gives me a little hint about the bacteria load or the yeast load. Plus, it gives me another hint on heavy metal toxicities. And it also lets me find out about the fatty acids and the essential fatty acids. So, not to mention, it also will tell you about the glutathione. So that's a book, and that one is a really good one to have. That's a bit of an esoteric test you're not going to find at every lab, like LabCorp does not do it, Quest does not do it, but Genova Metametrics does it. So with my clinic, we made an arrangement for another company to be the middle person. And yes, it takes a little longer to get the results because we have a middleman, but we get insurance to cover the cost. And that could save you like $400 out of pocket. These tests are not cheap. Any other questions?
You mentioned Lyme disease.
Yes.
What are typical recommendations if you find a tick?
Okay, you just opened up a can of worms. Treatment in itself is going to be almost as varied as the different doctors you see. Some stay by the CDC or the infectious disease recommendations, and basically you have to have certain signs and symptoms which won't pop up for maybe 2 to 3 weeks or even a month, and then you sort of almost missed your window, okay? There is a nice little tidbit. There was a study that if you have a tick bite and you take 1 dose of an antibiotic, whether it be amoxicillin, which is the first line, or if you're penicillin resistant or sensitive, doxy, just 1 dose, like 1 day's dose, within 72 hours of that tick bite, you can bring down your chance of getting Lyme disease by 80%. So some people like to keep, especially if they're outdoorsy, they just keep a little bottle in their cabinet. Now, again, I don't like to give antibiotics without probiotics because we kill a lot of good guys with the bad. So always remember your microbe world is so important. Anything else? Great. Have a great one. All right, thank you.